How can a traumatic brain injury manifest itself after birth? Want to know what I'm getting at here? Stay with me as I share with you some really important information. Hello, I'm Marcus Boston, and I am a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about this subject: birth injuries, traumatic brain injuries after birth. Before I get to the answer to the question of how do these things manifest themselves, I want to go back and I want to give you some important information or give you a foundation as to how these calls can generally come into my office. And a lot of times we will have a mother who was really dealing with an uneventful pregnancy, did everything that she was supposed to, followed all the directions from her medical providers, and when it came to that day, to give birth, she thought that everything was going well. Family thought everything was going okay. But what can happen is during the vaginal delivery process, the baby may be in distress. And how doctors and other medical professionals can tell how well a baby is tolerating a vaginal delivery is they can use this important tool called the fetal heart monitor. That's right, the fetal heart monitor. It plays a very important role in vaginal deliveries. And what this monitor does is it essentially looks at the baby's heart rate. There's some other things that it's also taking a look at, but that's the main focus. One of the main focuses here is to look at the baby's heart rate. And normally what we will see is for a normal baby, the heart rate will be anywhere between 120 to 160 beats per minute. And what can sometimes happen is there could be indications on this fetal heart strip that the child is no longer tolerating a vaginal delivery well. And what can happen is that if this baby is not tolerating the delivery well and is having other complications or other things that are occurring, the child can suffer a brain injury. And in many cases, this can be due to the fact that there is a reduced level of oxygen getting to the child. And we all know that if we have a reduced level of oxygen or reduced level of perfusion, blood and oxygen getting to the baby for a considerable amount of time, then you can have an injury to the baby's brain. How parents can see this or how they can be on notice that a traumatic brain injury may have occurred is their baby will be blue in color, for example, or their baby will suffer from seizures, or the baby will have to be resuscitated, or the baby will have to be taken to the NICU, or there could be meconium present. The meconium could have gotten deep into below the cords. So all of these things after birth can sometimes tip parents off that there may be a traumatic brain injury that occurred during the birthing process. In addition to just looking at these physical signs, parents can also notice maybe in the medical records or when talking to the baby's medical providers that the term hypoxic ischemic encephalopathy may be used, or the child may be dealing with a mixed injury on the scans. On the MRI scan, you may have an acute asphyxic event, or you may have a partial prolonged asphyxic event that may be present. So all of these things can show parents that a traumatic brain injury possibly occurred during birth. So why have I taken the time today to talk with you about this really important information? Because if you are watching this video, more than likely your baby has suffered a brain injury and you have questions about the challenges that your child may be facing into the future. You may be concerned about medical care. You may be concerned about how are you going to be able to provide or do certain things for your child going forward. If you have these things on your mind and you would like to speak with me further about what's going on, this is what I invite you to do. And remember, taking this next action costs you absolutely nothing. And what is that? To pick up the phone and give me a call. I could be reached at 301-850-4832, or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice and childbirth injury questions just like yours all the time, and I'll be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Take care and enjoy the rest of your day.